I was part of a team that did a survey of primary care physicians after the election to try to get the temperature on doctors in terms of what they are thinking about in terms of changes to the law. And we saw a couple of things in our survey results. The first thing, and again, these were primary care physicians, but the first thing we saw is that there's a relatively high level of interest in seeing some modifications to the Affordable Care Act, but very low level of support overall for repeal of this law. Just 15% of primary care physicians in our nationally representative sample supported full repeal of the ACA. And even when we looked at physicians who reported voting for Donald Trump, who of course ran on repeal, just over a third of them supported repeal. So the support in the physician community is pretty meager in terms of thinking about complete repeal of this law, but certainly there's interest in making modifications. When we ask doctors about their views on the key aspects of the ACA, just like the general public, everybody loves the insurance market regulations that are in the ACA. More than 70% support the system of subsidies and the Medicaid expansion. And then when we asked about some modifications to the ACA and new policies, the things that seemed to concern doctors the most were some of the ideas around deregulating insurance markets and having less benefits, and ideas around greater cost sharing and high deductible health plans. I think that physicians in general are not interested in being in the business of running collections operations and having patients who are suffering from a lot of medical debt and having a difficult time accessing care that they need. And so I think that's what we saw. We need to think about the riskiest populations and what we do as a society to try to protect those populations. And I think, a lot of what's being proposed, I worry about the erosion of investments in these populations and that they'll be a little bit on their own to manage some of these difficult circumstances going forward.